This is an anatomy tutorial in an angled coronal plane using T2 weighted images. The gyrus rectus, olfactory bulbs, and orbital gyri are landmarks on the inferior portion of the anterior frontal lobes. We can see the second cranial nerve, or the optic nerve, surrounded by cerebrospinal fluid in the optic sheath. The nasal cavity contains air on the right, and on the left, the more congested mucosa displaces air from the nasal cavity. On the left side, swollen mucosa in the nasal cavity displaces air. Maxillary sinus, watery mucosal thickening, has bright signal on this T2 weighted image. Moving one slice back, we see CSF in the longitudinal fissure. Here we see the superior, middle, and inferior frontal gyri. On the next slice, the tip of the temporal poles now are visible. And here we can see 3 unnamed cortical veins. The same image also shows us the muscles of mastication. We'll hear a little more about those later. Optic nerves are well seen surrounded by cerebrospinal fluid in the posterior orbital apex. Sphenoid sinus air cell, which normally contains air and would be black, has mucosal thickening. On this slice, we can see the frontal and temporal lobes are separated by the lateral or sylvian fissure or sulcus, outlined here in red. Notice the black dots in the lateral fissure. These are middle cerebral artery branches, pointed out here. And this is an anterior cerebral artery branch in the longitudinal fissure. Here we have optic nerves coursing medial to the anterior clinoid processes. And moving farther back, we see that the lateral or sylvian fissure goes over several slices, and once again we see the black dots representing branches of the middle cerebral artery. This image shows the anterior cerebral arteries on each side within the longitudinal fissure, just in front of the genu of corpus callosum. Here we are in the anterior portion of cavernous sinus, and we can see internal carotid arteries within cavernous sinus and then above cavernous sinus after they have emerged. Here we point out the genu of the corpus callosum, over which the right and left anterior cerebral arteries curve. Circles mark the foramen ovale, an opening in the skull on each side. May be easier to see now without the circles. And through that foramen on the left, we can see the third division of the trigeminal or fifth cranial nerve, going through this foramen to innervate motor function for the muscles of mastication. Make note that the falx cerebri, pointed out here, is small anteriorly. As we go posteriorly, it gets taller. Here we have again the superior, middle, and inferior frontal gyri as well as the superior, middle, and inferior temporal gyri. This is the cingulate gyrus and the subcallosal area of the limbic lobe. The pituitary gland is visible in the sella turcica and is surrounded on each side by the cavernous sinus. This is a good clinical study question. Distinguish orbital apex syndrome from cavernous sinus syndrome. Since the ventricular system is coming into view, I've put in a diagram of the ventricles to show about where the angle coronal image is oriented with the ventricles. The frontal horn of the lateral ventricle is shown here. Here is the head of the caudate nucleus. The anterior part of the putamen, and this is the anterior limb of internal capsule, important white matter that runs between and separates the caudate nucleus and the putamen. It is worth remembering that the internal capsule fibers separate the caudate nucleus and the putamen and globus pallidus. The putamen and globus pallidus together comprise the lenticular nuclei. The nucleus accumbens is located here where the putamen, head of caudate nucleus, and anterior limb of internal capsule converge. The nucleus accumbens is important in mediating the experience of pleasure. Here is the anterior body of corpus callosum and anterior cerebral arteries in the lower portion of the longitudinal fissure. This structure is the optic chiasm, and it's within the suprasellar cistern. These are middle cerebral artery branches in the lateral sulcus. This is a good place to stop and get ourselves oriented. The structure marked with the arrow is the condyle of the temporomandibular joint. Place your fingers just in front of your ear and feel the bony prominence of the temporomandibular joint condyle. This is the coronal plane between your fingers where the structures shown in this image lie within your own head. Inferior frontal and superior temporal gyri cover the insular cortex, indicated in red. After exiting the cavernous sinus, the internal carotid artery terminates, and does so by dividing into the anterior cerebral artery that heads toward the midline and the middle cerebral artery that's directed laterally toward the lateral fissure. At this level, septum pellucidum separates frontal horns of lateral ventricles, and small veins are seen along the septum. Head of caudate nucleus is here, and here is the putamen. These deep nuclear structures are separated by the internal capsule fibers, and that's a relationship we need to remember. The basilar artery lies ventral to the brainstem in the midline. Frontal horns and temporal horns of lateral ventricles, and the third ventricle lies in the midline. Hypothalamic tissue forms the lateral and inferior walls of the third ventricle. Anterior commissure fibers connect corresponding portions of the right and left temporal lobes. Amygdala are thick portions of gray matter continuous with the medial temporal lobe cortex. internal capsules, here the anterior limbs, course between the caudate nuclei, shown in red, and the lenticular nuclei, consisting of the smaller and more medially placed globus pallidus and the more laterally situated putamen. At this level, just above the anterior third ventricle, we can see the columns of fornix approach each other in the midline where they will begin to curve posteriorly. The columns and body of fornix are nicely demonstrated on the sagittal. The belly of the pons is located here, where it forms the floor of the interpeduncular cistern. Superior cerebellar arteries course beneath the tentorium to supply cerebellum, and they lie just below the posterior cerebral arteries that course above the tentorium to supply the temporal and occipital lobes. The optic tracts extend back from the optic chiasm and continue laterally to reach the lateral geniculate body of thalamus to mediate sight. Nerve fibers within the cochlea, demonstrated here, mediate perception of sound and have a cortical projection to the superior temporal gyrus after those fibers make a synaptic connection at the medial geniculate body of thalamus. So why are the cochlea bright on T2 weighted imaging? Anterior median sulcus of medulla separates the pyramids. The pontomedullary junction is the site of exit of the abducens nerve, or sixth cranial nerve. Trigeminal nerves, cranial nerve 5, are visible in the cisterns and are heading anteriorly to enter Meckel's cave. Internal auditory canals conduct the facial nerve, or seventh nerve, that gives motor innervation to the face, and the vestibulocochlear nerve, the eighth nerve, that mediates hearing and balance. The circles indicate the semicircular canals and vestibule. Why are the vestibule and semicircular canals bright on this T2 weighted image? The interpeduncular cistern gets narrower as you go posterior. Remember, the mammillary bodies are the roof of the interpeduncular cistern, and they lie between the cerebral peduncles. Interpeduncular cistern has the belly of the pons as its floor. Moving back, we have a coronal plane through the foramen of Monroe. This is a connection between the lateral ventricle on each side with the midline third ventricle. A blood vessel here, shown in dark, is the thalamostriate vein and is a dependable vascular landmark for the foramen of Monroe. And these arrows mark out the midline third ventricle into which the foramen of Monroe drains the lateral ventricles. Tiny bumps in the walls of the interpeduncular cistern represent the third, or oculomotor nerves, exiting. The flocculonodular lobe of the cerebellum is the smallest lobe, and it now is pointed out in the cerebellopontine angle cisterns. At this level, the medulla and pons lie below the tentorium, which is a reflection of the dural tissue that lines the skull and separates intracranial space into compartments. The cerebral peduncles, also known as crus cerebri, extend superiorly from the upper pons and conduct major tracts like the corticospinal tract fibers that run through the cerebral peduncles and course toward cortex. Bodies of caudate nuclei have gotten smaller as we go farther posterior. Note the constant relationship of the internal capsule fibers coursing between the caudate nuclei and the lenticular nuclei, comprised of the smaller medial globus pallidi, marked in yellow, and the larger putamen, marked in blue. At this level, the red nucleus is visible. Fibers of the internal capsule extend upward toward cortex through the cerebral peduncles. The globus pallidus is here. The putamen is here. This is the hippocampal formation, and this is the parahippocampal gyrus. The middle cerebellar peduncle is seen here, and these fibers comprise much of the bulky belly of the pons. At this level, lateral geniculate body is seen where fibers of the optic tract arrive and synapse, relaying information to the visual cortex to mediate sight. And the medial geniculate body, pointed out here, is where fibers from the cochlear apparatus synapse, relaying information to the superior temporal gyrus to mediate hearing. These arrows point out the posterior portion of the putamen, tapering as we get near the end of it. And we continue to see the parahippocampal gyri as we move posteriorly. At this level, the dotted line in the midline is on the cerebral aqueduct, which connects the third ventricle, not visible on this image, with the fourth ventricle, noted by the red arrow. Superior cerebellar peduncles are much less bulky than the middle cerebellar peduncles. This is the level of the quadrigeminal plate, which is this somewhat square structure in the midline. And the quadrigeminal plate is made up of the right and left superior colliculi mediating sight and the right and left inferior colliculi mediating hearing. The pineal lies in the midline above the quadrigeminal plate. The posterior thalami have an ovoid or egg-like shape in this plane. The falx cerebri in the longitudinal fissure separates the hemispheres and at this point is much taller than on the original, more anterior image where we pointed it out. This is the level through the atria of the lateral ventricles, where the posterior body, the temporal horn, and the occipital horns of the lateral ventricles come together. So the arrow points out CSF within the atrium of the lateral ventricle. This is the splenium of the corpus callosum. And here is more of the cingulate gyrus that stretches over the length of corpus callosum. This arrow points out the tail of the caudate nucleus, quite small at this point. The crus of the fornix swings laterally at this location and then courses laterally in the temporal lobe. When the cingulate gyrus courses around the back of the splenium and just goes under the splenium, its name is changed to isthmus of cingulate gyrus, and then progressing anteriorly and laterally, it is changed in name to the parahippocampal gyrus, which we already have seen. Lingual gyrus of occipital lobe is named for this tongue-like configuration we can recognize on this image. Its relationship with the parahippocampal gyrus also is nicely demonstrated in the sagittal images. Just lateral to the lingual gyrus is the occipitotemporal gyrus, which stretches anterior to posterior along the inferior aspect of the hemisphere. The midline portion of cerebellum is the vermis. Several constant deep veins converge to form the vein of Galen beneath the splenium in the midline. Is this a T1 or T2 weighted image, and how do you tell?